computer. Okay. All right. Welcome everyone to our monthly webinar for ACAP. I'm Catherine Braun. I am the president, and I need to ask you all to mute if you are not muted now so that we can hear our speakers. But this month, our topic is on addressing elder abuse through legislative measures, critical analysis. It's just very exciting. Whenever Mala puts together one of these webinars, she does just a bang up job, and we get to know some new people working in the Asia Pacific region. And this month, we're going to hear from Noriko Tsukada from Japan, Tan Ma Pin from Malaysia, and Hani House from New Zealand. We don't hear too many times from Malaysia or New Zealand, so we're very, very happy to have them. Of course, Japan, which is one of the leaders in the world for the aging population that we hear. We always are interested in hearing what's going on there, so it's very, very exciting. This is supported by the Barbara Cox Anthony Endowment on Aging at the University of Hawaii. Just a little bit about ACAP. Our mission is based in friendship. We want to share friendship and best practices for active aging. We like each other a lot, and we hope that that you will join because you like other gerontologists and you want to learn from them and you want to share. We have a bi-monthly bulletin, but I really need articles. If you want anything in the bulletin, I need articles. It can be about anything. They can be short, one page, a photo or two, what you're doing, what you publish, anything is good for us. We have monthly webinars, which are very successful because ACAP members take turns hosting them. And we have Mala this month who put together a very good one. And she did one earlier this year too. So she's one of our stars in leading these webinars. And we participate in conferences as much as we can. Over COVID, of course, by Zoom, but now getting more and more in person, which is terrific. Next slide. This is old and I should update it, more than 1,400 members now. And one of the reasons we have a lot of members is because it's free, free. And if you come to one of these webinars, you get added to our list. So you don't need to even ask me to be a member. If you've come here, you're a member. But our bulletins, I'm just telling you about the deadlines. Actually, the May 20th deadline, I didn't have any articles. So it's now June 20. So please send me any articles that you have that you want to publicize, even what is it that you do, aging in your area, your programs, your hopes, your fears for the world that's aging, anything. Here's our monthly webinars. We're on new initiatives to stop elder abuse. This was the old title, but it's still, we're trying to look at positive solutions we can share across countries. Next month on advanced directives. The month after that, active aging in Africa. The month after that, depopulation. October is free. If you have a good idea for October, please let us know. And then actually November is going to be about New Zealand and Australia. So that's different. And then the active aging in Nepal will go to December. So we have lots of good things, but you can see it's always a work in progress. So send us your ideas. We have members mostly in Asia Pacific, but also from Canada, US, Africa. In fact, we often get some people from Africa that have their bot just record this. They can't come because it's the middle of the night, but they have their bot record it. So we appreciate that. Here's some of the countries of the people who've registered for today. Thank you very much. And now I'm going to turn it back to Mala, who is going to introduce our speakers. But first I'm going to introduce Mala. She is, and I'm going to stop my sharing for now because I want us to focus on Mala, who is an amazing person. Mala, we've never met in person, but we have met on Zoom many, many times. She's a sociologist, a gerontologist, a health social scientist. She is a retired professor, but she continues to research, consult, and write. Oh my gosh, every time I turn around, she's got another book out. And these are a lot of edited volumes, so she really, puts forth the voices from people around Asia. I just admire that so much. She has a lot of affiliations with national and international organizations and is the Asia rep for the International Network for the Prevention of Elder Abuse, which is one of our co-sponsors. She's on our board, and she also has her own organization called the Development Welfare Research Foundation, another co-sponsor. So my goodness, Mala, it was just such a wonderful thing when I met you. And it's only been the last 2 or 3 years, but you're just such a great representative for India for ACAP. So thank you everyone for coming. I'm going to turn it back to you, Mala, so you can introduce your speakers.
Yeah. Thank you very much, Catherine, firstly, for a very nice, warm welcome address. And secondly, for a very generous introduction. No, I have been part of ACAP not just for 2-3 years, for I think 6 years now. So it's lovely to be part of this. So greetings of the day to everyone. And we have organized this webinar to mark the World Elder Abuse Awareness Day, which is designated as 15th. Sorry? Can you hear me?
I think there was somebody not on mute, so I'm going to go through and mute everyone.
Yeah. Okay. Yeah. So greetings of the day. We have organized this webinar to mark the World Elder Abuse Awareness Day, which is designated as 15th June every year. It was initiated by the International Network for the Prevention of Elder Abuse in 2006 and recognized as a United Nations Day by the General Assembly in its resolution. And I'm very glad to say that UN adopted it in 2011. And since then, with the IMPIA's efforts and the UN efforts, over 56 countries celebrate or observe this day annually. And we have meetings happening throughout the month of June in many places. And today I'm very happy and I welcome warmly Susan Somers, who is currently the president of IMPIA, and she is a strong supporter to this cause, and I work very closely with her. In fact, I have been involved with this event of World Elder Abuse Day right from its inception. When I was incorporated as a functionary of IMPIA in 2002 in Spain, where I was part of the World Assembly on Aging being held in Madrid. And then I was the national representative of IMPIA for 8 years, and we organized a big event in New Delhi in 2006 with the support of the Ministry of Social Justice and Empowerment, which is the nodal ministry concerned with issues of older persons. Pertinently, while the ministry provided support to this program, which was part of my NGO Development, Welfare and Research Foundation, they had hesitation in acknowledging that abuse of older persons is happening in India. However, they did confess that, as also stated in the National Policy on Older Persons, formulated in 1999, certain levels of friction may happen in families which undermine the position, status, and dignity of older persons. Interestingly, after my various interactions with officials at the ministry and also with the government, taking note of the growing research on increasing incidences of abuse of older people in the Indian situation, as well as awareness rising globally on taking action to stop elder abuse, the government came forward with a bill, the Maintenance and Welfare of Parents and Senior Citizens Act, in 2007, that made it obligatory for adult children to care for their parents. The focus was to address the needs of older persons, provide a monthly allowance, and protect their property. Importantly, this act brought focus on the need to care for older persons, with government making a protocol for the welfare of parents who cannot look after themselves. It emphasized on filial piety more than anything else, and while as a legislation, it has gone through certain reviews and consequently been amended in 2013 and again in 2018, though not still approved by the Parliament Cabinet, but yet it is seen more as an instrument to provide for maintenance, which would allow an older person to live a life of dignity. This act and practice cannot be seen as a stringent measure which would manage or stop cases of elder abuse. I will be discussing in more detail the Indian case a bit later, but with regard to this webinar, an important issue arises, which is, can legislative measures be effective, and should they be the only means in tackling the growing menace of elder abuse, as the population of older persons is rapidly increasing across the globe? As you will notice through the various presentations today, there is no clear answer to whether legislation should be an appropriate instrument to minimize and stop abuse. The pertinent question is, should there be other ways to address elder abuse? Many experts recommend caregiver interventions, such as reducing the burden of care, having management programs which minimize risk of misuse of financial funds and financial exploitation. They also offer more of community-based resources that can help in protecting and safeguarding older people. While in many countries, legislations for addressing elder abuse are in place, but for many, it is important to have coordinated response that involves various systems such as healthcare, adult protective services, criminal justice mechanisms also, and many more. So there is need to increase the political priority on the prevention of elder abuse. Today, we will hear perspectives from different countries, and towards the end, we can conclude. So I would now like to invite Noriko as the person to take forward the presentations, because one, she has to leave early. So I would like to introduce her. She is Professor Noriko Tsukada from the Nikon University College of Commerce in Tokyo, Japan. And she has been a very close professional friend of mine for many years. She's worked closely with me on many issues and has contributed to my books. So thank you, Noriko, for accepting my invitation to join in today. She's a full professor at Nikon University. She has received an MA in education, and she has also earned a university degree from Miami in 1993 and a PhD from UCLA in 1997 in the US. Her research includes foreign care policies and elder abuse. So today she is going to talk about topic is the Japanese Act for Prevention of Elder Abuse, and discuss with her what is the situation in Japan. Noriko, over to you. You're going to share your screen yourself.
Thank you very much, Mala. Can I share my screen?
Yeah, please start.
Oh, okay. Okay, can you see? Okay, today.
Yes, we can. Yeah, Noriko,
thank you.
carry on.
Thank you very much, Mala. Hello, everyone. I'm Noriko, professor of Nihon University College of Commerce. Thank you very much for inviting me to this program, Mara. I'm very honored to be part of this program today. And hopefully to see you at GSA if you are coming to be held in Seattle. Okay, today I am going to follow this outline. First, I will briefly explain 4 standalone acts to prevent abuse in Japan, and then we'll introduce an overview of Elder Abuse Prevention Act. And then I will describe trends in elder abuse in Japan. And finally, after, I will introduce new policies for preventing elder abuse in Japan, and then 5 amendments, proposals made by Japan Academy for the Prevention of Elder Abuse. Okay, I have 15 minutes, right? Okay. In Japan, we have 4 standalone acts to prevent abuse, including child abuse, and spousal abuse, and today's topic, elder abuse, and abuse of persons with disability. I'm sorry. The number highlighted in green shows the number of amendments. As you can see, we have none since its enactment. Also, the official name of the act is the Act on the Prevention of Elder Abuse, Support for Caregivers of Elderly Persons and Other Related Matters, but I will use a shorter version, Elder Abuse Prevention Act. Let's move to an overview of Elder Abuse Prevention Act. I think this is really unique to you, some of you, because legislation, the name of the legislation include the support for caregivers of the elderly persons. I think that is a little different from others. Okay, table 1 shows the tenets of the Elder Abuse Prevention Act. The act was enacted on November 9th in 2005, and it is noted in the supplementary provisions that they will review the act after 3 years of enactment, but never done that, never has been amended for the past 19 years. One thing I would like to draw your attention in this table is the part that I highlighted in light blue, kind of lower part of the table. As you can see in the act, elder abuse are defined as abuse committed by caregivers in domestic settings or personnel of long-term care institutions or service agencies that provide with nursing care services. That means to be able to be covered by the act, they have to be caregivers. This table shows reporting requirements for domestic settings. As you can see in the parts I highlighted in red here. Elder abuse, anyone. This is for domestic settings. Anyone who discovers an older person who is believed to have been abused by his or her caregiver must promptly report the incident to the municipal government if the older person's life or health is in great danger. So if not, then we have to make an effort to report. So the people, ordinary people like me, cannot really distinguish if the person is in great danger or not. So this would be a problem. This table shows the same tenets, but for institutional requirements, reporting requirements for institutional settings. Elder abuse reports are required for personnel of nursing care institutions and nursing care service agencies who discover an older person who is believed to have been abused by someone working for any of these institutions or service providers must promptly report the incident to the municipal government. That means healthcare professionals must promptly report the incidents regardless of the seriousness. But people like me, ordinary people, anyone who discovers an older person who is believed to have been abused by someone working for any of the nursing care institutions or nursing care service providers must report once again if the older person's life or health is in great danger. And other than that, we just have to make an effort. That's the difference. Okay, let's take a look at the trends of elder abuse in Japan. Table 1 shows, table 2.1 shows trends in numbers of elder abuse reports made and actual numbers of reports substantiated as elder abuse in for domestic settings. As we can see, reported numbers on elder abuse in domestic settings are increasing, but the proportion of elder abuse reports that was substantiated as elder abuse has been gradually decreasing, the lowest part, the proportion. This is for domestic settings. Okay, let's take a look at the institutional setting. This shows the same numbers for institutional settings. As we can see, not only reported number, but also number of reported cases that were substantiated as elder abuse has reached the highest to the year 2022. And the proportion, however, has been gradually increasing the past 10 years. So thank you for singing. Okay, let's next go to the next figure. This figure 1.1 shows trends in elder abuse in domestic settings from 2006 to 2022. Physical abuse is the highest type, I don't know, in your country. And the second largest proportion is psychological abuse, followed by caregiver neglect and financial abuse. Although the proportion has been decreasing, it is noteworthy the proportion of financial abuse in domestic settings are much higher than those seen in institutional settings, which we will see in the next slide. One of the reasons for this decline is saying that the abusers, about 40% of abusers for domestic settings are son, and about 20% of the abusers for domestic settings are husband. So they are not really taking care of the victims anyway. So that's one of the theories that the proportion has been decreasing. This shows trends in elder abuse in institutional settings. As for overall trends, although physical abuse is the highest, it appears to have been decreasing a little bit. The second largest proportion is psychological abuse, which is similar to the similar trends that we just saw in domestic settings, followed by caregiver neglect and financial abuse. Here, it should be noted that proportion of caregiver neglect has been gradually increasing as opposed to the trend seen in domestic settings. Figure 1.2.1 shows trends in reporters in domestic settings. Although the most cited reporters are care manager on the left in 2006, the proportion has been decreasing, as we can see. Instead, the proportion of police has been increasing very sharply, and it was the highest in the year 2022. Proportions of reporters such as family members and person himself or herself has been steadily decreasing. Figure 2.2 shows trends in reporters for institutional settings, who are reporters for institutional settings. And since 2009, the most cited reporters have been staff members and which has been increasing, as you can see. The second largest proportion of reporters for institutional settings are family members and relatives. But it has been sharply decreasing, especially this COVID-19 thing. They were not allowed to enter the institution to begin with. And instead, proportions of facility managers and former staff members have been gradually increasing. Next slide shows perceived causes of elder abuse in domestic settings. As you can see, the top 3 perceived causes include conditions of stress and fatigue of abusers, which abusers, caregivers at home, and conditions of dementia of the victims, and nature of and personality of issues of abusers. But in any causes, we can clearly see the influence of COVID-19 for the past 4 years. Let's move to the, let's take a look at the perceived causes for institutional settings. The top cause is on the left side is issues related to education, knowledge, and care skills of the personnel, followed by issues of stress and emotional control of the staff. Okay, it stays the same trend. Figure 4 shows trends in abusers in institutional settings. The top proportion has been nursing care staff, about 80%. It stays high. That is why the government recently they took action to educate them. Let's move to new policies that became obligatory this past April 1st. Right? After a 3-year transitional measures, from this April 1st, operating standards require all nursing care service operators to hold a meeting regularly to discuss measures to prevent elder abuse, and outcomes should be disseminated among the institutions. And operators should establish guidelines for preventing elder abuse within their organization. And operators has to hold regular meetings to prevent elder abuse to personnel twice a year. And they have to decide the person in charge to carry out the above 1 to 3 items. So they have to do that from this April, and they have been doing that. I think that this is because, as I just showed you, that the majority of the abusers come from nursing staff, care staff. They are abusers. At the same time, the reason why, because of the issue related to education, knowledge, and care skills. So that's why I think the government took action. That seems reasonable. Okay, future challenges that the Japan Academy for the Prevention of Elder Abuse, which is an academic organization with about 400 members, including lawyers and nurses and doctors and legal supporters and researchers and local government, municipality governments, workers and graduate students, which was formed 20 years ago. This year is the 20th anniversary, but we proposed 5 amendments. First, expansion of target facilities. Right now, the facilities is on institutions that are covered by a long-term care insurance program are covered by the legislation. So we want to expand more. We want them to expand more because after the enactment, a lot of fee-based nursing homes, housing for older adults with home care services were started. So we have to include them. So we need them to expand the target facilities. A second, clarification of the authority for prefectural governments to accelerate to make the long story short, as stated in the Act on Prevention of Abuse of Disability and Support for Caregivers, we want we want them to state that we also need establishment of prefectural elder abuse advocacy centers. Otherwise, government is only giving them advice, and it's kind of looking at the things from the far. We want to give them more authority to get involved more. The number 3, establishment of regulations for survey and research. Acts regulates research by the country, which I have shown. We use the data, their data, but local municipalities are not included in the survey. They are only responding to the survey. In order to clarify elder abuse cases and share information on fact-checking and response quickly and investigation, local municipalities should be included in the act as included in the Act of Prevention of Child Abuse. By the way, in Child Abuse Prevention Act, verification of serious abuse incident is also included. So verification is also needs to be included. For self-neglect is not included in the act right now. So it should be included in the definition of elder abuse to maintain the dignity of older adults. Okay, this is 5. And in summary, despite the fact that there is a statement that act should be reviewed 3 years after the enforcement in supplementary provision 3, no revisions has been made so far. Therefore, just the Elder Abuse Prevention Act needs to be reviewed promptly to begin with. Thank you. Thank you very much for your attention.
Thanks a lot, Noriko. Do you think you'll be able to stay for some time? Please look at the chat box, and I think there are 1 or 2 questions to you, one by Brian.
Yes.
And while I just say something about it, quickly look at it, and then I'll give you a minute to respond. So this was an important presentation which brought main features of the Japanese Act on the Prevention of Elder Abuse. It talked about the definitions of elder abuse and the abusers, discussed the reporting systems, and also the trends in number of elder abuse, both at the institutional and domestic level. So I am glad you shared some of the characteristics of this, as well as you talked of the challenges which are being faced. And it is very important as we move ahead in steps to stop elder abuse, to review all of this from a very analytical point of view. So thank you very much, Noriko. So if you want another minute to just because otherwise we are running short of time.
Sorry.
To 1 or 2 questions.
I use my time a lot. Yeah, I'll be here until 1:05. 5 after 1 o'clock in Japan time. But I think I need to answer to your question, Mara. I think legislation is important. I think legislation is important to amend.
Yeah, so because we will be coming for a discussion towards the end of the presentation. So if you're here, very good. So we now move on that I will make a short presentation on India. So I'm going to share my screen. Can you see it all?
Yeah, keep trying.
Yeah. Can you see it?
You should be able to share, but I'm not seeing it. Yeah, did you hit the share screen button, the green share screen button?
Wait. Can you see it now?
No. Yes,
Can you?
yes, it's coming. There it is. There it is. We see it now.
Yeah. So I'm going to address elder abuse through legislation, the India case. And a lot of this work is a part of my research as a writer, as well as an activist. working for both IMPIA and for my organization, Development, Welfare and Research Foundation, and also my other partner, Mrs. Kiran Puri, who's not present here today. We are doing a lot of programs to raise awareness on this. So very briefly, I'm just going to touch on very crucial issues. So one is to talk about some facts of elder abuse in India. And, we know that since last 10 years or so, various surveys have been conducted, both from the UN side, from various NGOs. And there is also a big study which is now being carried out, which is called the LASI study. So about almost 10 years back, when HelpAge got involved with conducting some of the surveys, it was seen that according to their report, half of India's elderly, that is 50%, reported experiencing abuse. And this is a very alarming figure and a very disturbing figure. And more than that, what is disturbing is that 77% lived with their families. So abuse from family members is a real concern. And later studies also indicate prevalence of elder abuse increasing. Perpetrators, mostly family members, but friends and neighbors too indulge in this. And we are now noticing many cases of institutional abuse and also various kinds of financial abuse, which is becoming a big issue. And what is the form of this is using abusive language in dealing with older parents, neglecting them, isolating them, leading to a lot of emotional abuse, which has a high prevalence rate. And there's a lot of financial exploitation, property grabbing, especially very visible in many states of India. Abandoning parents is a very common practice. And, it is so disturbing that there are about 7-8 places in the country which have been identified where parents are abandoned because they have a religious character to it. And people feel that once they will be abandoned, somebody would take care of them. And the children have kind of got rid of with a little guilt that somebody there is looking after them. And also we see cases of physically hurting them. And this is also when I am talking to some of the doctors at some of the medical clinics where older people, geriatric clinics, they say that we do see signs of bruises, signs of, physical torture, which is being done. But again, the reporting system, the mechanisms to deal with it are little not very well organized. So action very often is not taken in a very strict sense, but more of communication is done with family members so that some abuse situation is minimized. And we see it cutting across all the socioeconomic groups, and widows are seen to be easy target for abuse. Reporting of cases is low, even though various surveys are able to identify due to their personal touch with some people and going from family to family, working at grassroots level. But the reason why it doesn't get reported is there are communication gaps, illiteracy among older people. They don't have lack of knowledge about how to go about it and don't know how to deal with elder abuse. Moving ahead, so therefore we have this legislation, the Maintenance and Welfare of Parents and Senior Citizens Act, which was brought in 2007. And it in many ways addresses elder abuse. It is a legislation that provides a legal framework to safeguard the rights of senior citizens against exploitation and abuse. It emphasizes on the responsibility of the children and various inheritors to care and support older parents. And it provides guidelines for state governments to establish old age homes for vulnerable and disadvantaged older people. So it has also guidelines to provide medical care to aging parents. So in a nutshell, there are various aspects which are taken care of. So it makes it legally obliging for elder children to provide maintenance, a monthly allowance to the parents. And it also provides inexpensive and speedy procedure to claim maintenance. So since enacting this act, senior citizens um, were seen to transfer their movable property and on the condition that the transferee shall provide basic amenities and take care of the physical needs. But many older people find that the children, after taking property, after taking their financial assets, refuse to take care of them. And through this act, they can have the property transferred back to them. And, this way, the children are pressurized to take care of parents. And this act also makes abandoning a senior citizen in any place a criminal offense. Now, what is I need to point out here is, I mean, one can go on and on talking about the act and the way various case studies and all. But the way it can protect older people depends on various factors. The implementation of it is weak because people don't report, because they are not aware of it. Secondly, getting children to give maintenance has its own various issues, and the enforcement of this legislation is not so strong. And also, we find there's not enough data which is showing that how, awareness, lack of awareness is becoming a big cause. And what we need to do is let older people get aware of their rights and assert their position to demand care. So enforcement can be challenging due to legal complexities, family dynamics, and very often children who have more resources, get in conversation with the enforcement agencies and get them on their side. And the older people have various resource constraints and they cannot carry on, dealing with the case. So they find filing complaints here, all this has many difficulties. So we also find there are issues in terms of effective reporting. And so without reporting, which, deals with exploitation, neglect, and abuse, nothing much can be done. And although the government has set up, and few NGOs have set up legal clinics, helplines, counseling services, which can improve the effectiveness of the legislation, but these are all scattered and they are limited, and therefore their reach out is low. But we are working on it to improve the situation. So what is also very important is that in general, it is seen to have other options to address elder abuse. So there we need a multifaceted approach with the priority given to combat ageism. And we need greater neighborhood and social cohesion. Physical order may be reduced in cases of elder abuse perpetration. Have more of legal frameworks that protects and safeguards older persons' interest in terms of making wills, establishing trust to take care of their money matters, etc. Improves social and health security benefits, emphasize on self-care, increase adult literacy programs, include knowledge on digital learning. And in short, what we need is that while, yes, legislations play a crucial role, but they must be accompanied with focus on prevention, reporting, and intervention. So finally, I would like to say that just criminalizing and legalizing family care of older people may not be the right way to stop it. What we need is building up a moral aspect of it, and we need to, as a lot of my work and writings also emphasize, understand the issue more from the social, public health, and the wider context that brings attention on caregivers to not just on victims. We need a holistic approach which requires creating a softer response with family understanding the situation, having more respite care problems, and understanding the root cause of it. So we need awareness on issues related to older people. We need a more right-oriented perspective. We need training for caregivers and provisions to reduce burden of care. So in short, it needs an integrated societal response, and we need many more partners in the process of building up awareness and stopping elder abuse. So there is need for more service-oriented solutions for the well-being of older persons, and we need to take into account the various heterogeneous concerns. So I will stop here. Thank you for your patient hearing. And what I do want to emphasize is that we will come back to the discussion after the other two speakers have also presented their talk. So now we move on to Professor Tang Mo Pin, who's from Malaysia, and she will be talking of protecting vulnerable Malaysians, considerations for our law for senior citizens. And she's a professor of geriatric medicine at the university. And after completing her undergraduate medical training at the University of Nottingham and her core medical training at Nottingham City Hospital, she obtained a national training in geriatric medicine at Newcastle in UK. And she also took a full-time research training at the Institute of Aging and Health at Newcastle University. She is currently the principal investigator of the Ministry of Higher Education in Malaysia, which is involved with long-term research project on frailty in later life, and is the current president of the Malaysian Society of Geriatric Medicine. Thank you very much, Tan, for my invite to you to be part of this. And we are looking forward to your presentation. Carry on now, Tan.
Thank you. Hi, thanks very much for inviting me. And I'm delighted to meet so many people. And yes, I hadn't heard about ACAP before this, but I think I'm going to keep coming after this. Yeah, so I'm a geriatrician. So most of my time I spend looking after older people who are not actively aging and who are actually experiencing ill health. And elder abuse is actually quite remarkably common in our setting. Underreported and definitely not recorded. So and the beauty about Malaysia now is that we are currently drafting this law, so the ability to actually share notes with our speakers is actually extremely advantageous at this stage. So where are we in Malaysia? So we have a rapidly aging population, and we only crossed the line for population aging literally 3 years ago in 2021, when 7% of our population reached 65 years and over. And this is what is very popular among the newspapers. There's constantly reports of older people being abandoned. And this is just one of those articles stating that there are more and more older people being abandoned. Maybe there's a reduction in moral values, and now we need laws to protect older people. It rarely ever states the fact that the increase in older people being abandoned is probably according to the rate of increase in older adults living in our country. And unfortunately, we are in a climate of rapid political changes, and because of this, our ministers who change sometimes several times over one parliamentary term may not necessarily understand the issues that's related to elder abuse. And our greatest fear is that the bill that comes out is only going to address penalties for irresponsible adult children. So I'm just switch gears a bit and give you a little bit of background about how serious elder abuse is as a problem in Malaysia. So this is a National Health and Mobility Survey that was published in 2019, even though it was conducted in 2018. So it's actually quite old now. We are hoping the government is currently repeating it, but we don't think so. And overall, the prevalence of elder abuse is supposedly 9%. This is a survey self-reported, obtained by interviewing older adults. And neglect is how was reported as the most common form of abuse. And this is quite different from a separate survey that was done at the University of Malaya, the Peace Project. I was a member of the Peace Project. And in the Peace Project, the prevalence of abuse was lower, but we only did one population, suburban population, and financial abuse was the highest in that population. So this is results from the Peace Project. So we collected quite a lot of data, but most of the potential risk factors were not significant. So these were the significant risk factors that we found to be associated with elder abuse. And they were depressive symptoms, a history of abuse, so domestic abuse prior to the age of 60. Like our previous speakers have mentioned, the abuse perpetrators often sons and husbands. So domestic abuse that's carried on after the age of 60 is also a big feature of our elder abuse scene. And also those at risk of social isolation are more at risk of elder abuse. And this was also a study that looked at the older individuals' adverse childhood experiences. So what we also found was that regardless of whatever type of abuse, if the older adult had been exposed to adverse childhood experiences, then they were actually significantly more likely to experience elder abuse. So we actually found relatively few risk factors for abuse in our survey, but we didn't actually interview perpetrators, which is quite difficult. So this is actually, so I had to go to the international literature to look at what attributes perpetrators might have when it comes to committing the act of abuse. So this is actually the CDC. I know it's American and might not necessarily reflect our Malaysian population, but after doing research for quite so many years, I actually found a huge amount of similarities between America and Malaysia. So I don't think it's going to be hugely different. What they found, what the CDC website actually says is that the individual perpetrator commits abuse is more likely to have mental illness, substance abuse, physical ill health, past experience of disruptive behavior and traumatic events, stress, lack of training or perception, lack of preparation to care, and lack of coping skills, and also exposure to or witnessing childhood abuse and social isolation. And then there are also relationship issues, as mentioned by previous speakers, such as high financial and emotional dependence on the vulnerable elder, past family conflict, inability to establish positive pro-social relationships, and lack of social support, and societal abuse, which often happens in institutions, staffing problems, lack of qualified staff burnout, and stressful working conditions. But the CDC also suggested protective factors for the victim, which we didn't look at, and there are individual protective factors such as emotional intelligence, relationship protective factors, having social support, and community protective factors, which is sense of community meaning, residents feeling connected and are involved in the community. So this can potentially will provide us with a framework by which we can actually set our legislation to actually reduce elder abuse. But what should the law actually do? So it's of course very popular to punish the perpetrator. We could fine them, we could imprison them, but it's going to be really expensive to go and catch people. And we're talking about 5 to 10% of the Malaysian older population who actually have admitted to abuse. It might be a bigger problem that is underreported. So how on earth are we going to catch that number of people and waste taxpayers' money to prosecute them when maybe we should actually be concentrated, I think, our efforts on other things. And furthermore, the perpetrator might be the caregiver, and if you actually lock them up, then you've lost the caregiver. If you find them, they have less money to provide the care. And it doesn't actually fix the problem. It might act as a possible deterrent, but it doesn't prevent abuse per se, and because of the and might potentially increase the risk of abuse if you remove the older adult who has been abused and put them in an institution. We actually know that the risk of abuse is even higher in institutions. We don't have reported figures in Malaysia. Around a figure of 14% has been reported, which is higher than domestic abuse. And do we come up with filial piety laws? Well, we actually have issues with a shrinking productive workforce. And this productive workforce is called sandwich generation. So having to provide for their older adults as well as their children will actually reduce the chance of actually ever saving for their own old age. And we actually perpetuate the problem, and it might lead to increased resentment, hence increasing abuse. And furthermore, it absolves society and governmental responsibility towards dealing with elder abuse. So what should we actually consider for our new law? The new law should really aim at reducing the risk of abuses. And very simply, we could perhaps provide a break for the caregiver who's exhausted, who's very stressed, by providing them respite care or even long-term care, substitute the caregiver, provide them with training so they know what to do. We could actually provide them with counseling, especially preemptive counseling when they've experienced traumatic events. At-risk registries, the law should mandate the registry and mandate reporting. So there's a at-risk register that we can refer to, and people who are potential victims of abuse and perpetrators of abuse can actually receive help before anything serious happens. And then we should address antisocial behavior and child abuse as well. Ensure that the current laws on child abuse are actually enforced. We should increase public awareness, reduce social policing, instead let people know that actually dealing with population aging is a societal problem, and this is actually very much embraced by the UN Decade of Healthy Aging, making it a whole of society approach, and consider, as from a medical point of view, social prescribing and mandating that. Institutions should be properly regulated. There should be efforts to ensure that all caregivers are trained, because untrained caregivers are very likely to subject older adults to abuse. And they need to have background checks, and there should be offenders registries. So what laws do we actually need? So our senior citizens law should combat ageism, outlaw age discrimination, so the older person who's able to stay employed can remain productive, and policies should not discriminate based on age alone, and also healthcare decisions should not be discriminated against, should not discriminate against a person based on age, any person based on age alone. And we need to make the healthcare provider's role to maximize function, so not just save a life, but to maintain function, or to restore function after any illness or injury. And then we have a responsibility to identify social care needs and ensure adequate provision. So currently what happens is the older person comes to hospital, we treat the acute illness, and we tell the family to take them home. And the family often tell us they walk into hospital, but they go out in a wheelchair or in a stretcher. And that should no longer happen. And that we need to ensure that we provide training and counseling for caregivers as well. And there's one more thing that happens is that many of because of our older crowded hospitals, many very loving adult children actually take their parents to a private hospital, thinking the care will be better, easier to access, and they will be in a more comfortable setting. And this is when we have catastrophic health spending. So it's actually the responsibility of the doctor providing the service to ensure that there is enough money for rehabilitation and care post-acute injury, in which if there isn't, then they need to actually transfer this older adult to a private government facility to ensure that there's enough money later to actually provide rehabilitation and care. We need to require authorities to provide social activities, when they build a house, when in new housing areas, there should be provisions for social activities and exercise. And there needs to be authority should also provide vulnerable adult services. So that's me. Thank you very much.
Thank you very much, Tan, for a very concise presentation. And I'm, quite familiar with some of these Asian contexts, and we have certain similarities. And one of that is yes, abusers are often close family members, and dependency of older persons is a very sort of situation which makes older people very vulnerable to abuse. And gradually, yes, we need legal frameworks, but we need also an opportunity to look at these frameworks from a very holistic perspective. So you have brought out some of the issues which should be part of legal frameworks, how it should be operational, and also some of the challenges which come in terms of taking care of older persons who are being abused. So thank you very much. And now I invite our last speaker for this session. And after that, I hope many of you will put in your comments and we could have some discussion from all the speakers, talking about it. But meantime, I request speakers to keep looking at the chat and answering some specific issues which are being outlined there. So the next speaker is Ms. Hanny Hoss, who's a professional educator, and she's looking after elder abuse and neglect prevention at Age Concern New Zealand. And I'm so happy that we have somebody from New Zealand here. And I want to thank Brian, of our ACAP member and very close person who is part of our meetings, to suggest this, because we don't generally hear much from New Zealand. So very nice of Hanny to have agreed to talk about addressing elder abuse in through legislative measures in New Zealand. Hanny has been with Age Concern, and especially in the elder abuse and neglect prevention section for since 2013. She has personal experience with older people and disabled people in residential community and hospital settings, and has been involved with tertiary education, caregiving, counseling, teaching, and social work roles, and has been providing practical knowledge to advocate for the safety and well-being of older people. So thank you very much, Hanny, for accepting this invite and being part of this and promptly, agreeing to make your presentation. Please go ahead. You're sharing the screen yourself. Hanny, please go ahead.
Yes, I am sharing the screen myself. Yes, I am. Thank you.
Yeah, can you make your voice a little louder, please?
Yes, I just am trying to find that I'm sharing the screen and that you can see that. Can you see it?
Yes, it's there
Yeah,
now.
we can see your screen. Yeah.
You can see the screen? Okay.
Yes, please. Yeah.
Yep. Can you see me now? Thank you
Yeah,
very
good.
much.
Thank you.
Thank you very much for the invitation and for enabling me to be part of what is obviously a really established group that you are throughout the Asia Pacific region, and very pleased to be here for the first time today. Obviously, this is the topic that Mana invited me to share on, and so this is what I'm looking at in this brief time, and I'll certainly try to be very speedy so that there is some time for questions and discussion at the end, which is what you're looking at. So just to explain who we are, because clearly we come from a different background from some of the other speakers. We are an NGO in New Zealand. I'm part of the umbrella organisation, which is Age Concern New Zealand, based where that red spot is. This is Wellington in the capital city, but there are age concerns all around the country. Most of those have what we call an elder abuse response service, And we have been involved with elder abuse as an organisation for the past 30 years in New Zealand. And the reason why we speak to that is because elder abuse response services are community-based in this country and have arisen from the voices of older people way back in the 80s and 90s who were concerned that the issue of abuse was rising, and that has led to us being the organisation that covers most of the material but gives us a different perspective on how we talk about elder abuse. So I'm trying to turn it backwards on what we're saying. Is what I'm going to start off with saying is what's not in legislation that in New Zealand, just so that you know, and obviously the background, and this will be very familiar to you, but from our point of view, of the 18 principles that were agreed in 1991, Principle 17 is the one that we look at. Certainly not come into any legislation in New Zealand, and neither has already been talked about the elder abuse awareness that we also included in those 59 countries that you mentioned, Mana. We take a great deal of practical ways of using that day this month. And for us, it's really important that the United Nations has recognised that elder abuse is both a public health and a human rights issue, because that gives us a huge framework from which to be providing education, public awareness, as well as providing practical services. The other thing that's not in legislation, and I add that because we don't have any specific legislation that says this is the Elder Abuse Act. It's interesting to have heard from the other speakers who do, or have something in that name, but we do as an organisation, and everybody that works with elder abuse in this country, as in many other countries, and researchers, we certainly use that definition and use the different aspects of that definition to include what we're talking about. One of the speakers before talked about whether self-neglect should be included, and whenever that's debated in our country, we say, look, this is what it says. It's where there's an action or a lack of action. So we use this definition to our advantage, I feel, regardless of the fact that it's not in legislation. So what is in legislation? Nothing like what you've shared already, but these are a few things. From a human rights point of view, there's nothing specific that talks about older people. However, adults are included in the legislation that we've got, and that first time then when age was actually used, it wasn't about old age, it was about children who become adults in that teenage adult space, not specifically. However, it does include some form of remuneration in terms of a benefit system from age 65. So there is some legislative backup, but it's not specifically about elder abuse, it's about income. This act is probably the one that we think is most significant, because this is the first time that there was any recognition that adults who, to all intents and purposes, have all the rights of citizenship, may have, for reasons of mental capacity, not be able to exercise their rights. And this is where the start was of what was called enduring power of attorney, where someone could appoint a person ahead of time to say, if I should not be able to have the mental capacity to make decisions for myself, I can appoint people. On the second half of that is the personal orders, which is when somebody has never had those rights, people with intellectual disability who've never been able to have what's called mental capacity, that there could be orders placed through court to enable them to have support, advice, and advocacy. The other act that's quite significant in this country, because it came out of an issue around research of women who were not told that they were part of a research program about cancer. And out of that came a really strong act, and also what we call 10 health and disability consumer rights, where anybody who's in any facility that's classified as a health or disability service has these 10 rights. And I've just picked out the two that we most often look at from an elder abuse point of view. But again, these are not specific to older people, but certainly older people are included in that. The other things that have possibly had some impact in New Zealand legislatively is this inclusion in one of the amendments of the Crimes Act that categorized this thing called a vulnerable adult, which has never been categorized before in this country. And it is about provision of care, and in terms of, again, neglect, but it is based on people who are in the same household, because again, this amendment was drafted because of what had happened to children in their own home, nothing to do with older people, but it has been used for this. The other things that we have, Family Violence Act, first in 1995 and then updated in 2018. And these, again, don't specify elder abuse in any way, shape or form, but some of the provisions in them can be used by us and by police and others to provide more protection for a person, much more protection than a trespass order, which is about property, but protection for the person, so that a person who's been delivered with, that they are not able to interact with an older person. It's not just in their own home, it can be wherever that older person is. However, I'd say these provisions in the Act don't always work out that easily in practice. But what I'm saying is the provision is there in theory. Likewise, we have now the widening definition to include caregiving relationships, not just family relationships. I just want to draw attention briefly to the idea that there are also other issues that are around professional responsibilities, registration, where we have real ethical practices. And I just give the example of nursing, but they are for all our professions here. We also have a Competency Act that is about protecting the public from people who try to present themselves as health practitioners but are not, and also that protected disclosures, which is very important for anybody who wants to speak up for what's happening in a facility, if they feel that they're going to be marginalized by a boss if they speak up about abuse that they see about other workers doing. And I just add this in terms of privacy, because that's the other issue that we're really strong on in New Zealand, is about that people's information is private and that it can't be shared, and that we can only collect and retain information that's directly relevant. But there is a rule in the Privacy Code that enables us, if we're concerned sufficiently about another person, that we can disclose or seek information from another source, especially before we've actually had the opportunity to get the consent from the older person for us to work with them. Just want to add this little piece in about who we are, because our information is from our 30 years of involvement with providing services for people who are abused. And that's a difference from what you're providing in those wonderful statistics from information. I just want to give you a few slides of, this is the kinds of types that we do categorize types. We see most of the abuse, we see more than one type. And as you'll see, it's different from some of the ways that you have presented that in your presentations. But for us, psychological abuse, which includes cultural, social, emotional, and spiritual abuse, it sits behind every other type of abuse that we see. And that the biggest is from a half to a third is financial abuse, and those other ones are important for how we stand, but they're smaller numbers. So just for you to understand that. We're also very keen to say that elder abuse very seldom is a one-off event. Usually it's much more than a one event. Usually it's gone over a period of time. And this is the information that we get when we are first in connection with an older person, and get from them to understand how long it is that they've been involved in having abuse. And probably this is the biggest one that people are most shocked by, that we see mainly abuse in people's homes, and that while there's a percentage in rest homes, most of the abuse that we see is in people's homes. And this is how we categorize the alleged abusers that we see. And it's mainly family, but also that top corner of the light green is neighbors and friends and other people who an older person reasonably can trust to not be abusing by them. And obviously that worker sector is the smaller sector, not just in rest homes or those kinds of institutions, but also people and working in shops also can be part of that. So my question that I'm coming back to is exactly that. The one example that I will give you is that what we find is that even where we have the act that officially provides protection, we find that the enduring powers of attorney often are the abusers, that they take literally what is not their role. And these are the things in the act that say that they're only to act in the best interests of the older person. But we find they're often diametrically opposed in their own interest, not in the older person's interest, and not involving the person, even though the act says it much as they must do in making decisions, nor have any regard of whose money it is and that they have no right to the money. So even though there's legislation, I guess what we're saying is that isn't foolproof, and certainly doesn't mean that older people are automatically protected. Likewise, in criminal evidence, while there are a few cases that go to court, most situations don't go to court. And part of that is that police are very keen for prosecutions to be successful. And if they have any doubt that the witness of the older person themselves is going to be torn apart by defense lawyers, they're not going to take it to a court system for an older person to be humiliated, not believed, or put down. So we don't see that the criminal evidence is a mainstay of any of the work that we do in elder abuse. In fact, it's a very small part of any elder abuse that we do. And partly that's because older people don't want that. And one of the strengths of our organizations is that we are a community organization. And because of that, people come to us and talk to us and are prepared to talk because of that, not because if we were the police, they're not necessarily prepared to talk. They are living with the threat that if they speak out, if they go to the police, that they won't see their children again, they won't see their grandchildren again, and they won't have any connection. And usually that's part of the reason why the abuse happens in the first place, because they're dependent or feel isolated without them. So I want to end with a couple of controversial issues. We've recently had an End of Life Choice Act, and I don't want to go into it in any depth other than to say that this was raised as a possibility of abuse either way. And so that does raise controversial issues for us. Again, with advanced care planning that I know one of our speakers has alluded to, what that is not in any legislation. It's what people can choose to offer, but it isn't what people actually can say legally is binding. And that's the issue about where does enduring power of attorney sit? Do they actually do what the advanced care planning says? And then the other order is that even though under this act, people can be placed for their protection, it doesn't mean that they automatically have advocacy roles, and they can only be assumed if they are in care. And sometimes we're saying there needs to be more protection at an individual level, even though an ombudsman now can check the facility. And we have other ways of auditing facilities. It doesn't mean that every individual, if they've been placed under that act, will necessarily be receiving an individual person who advocates for them. I leave you with this question, because we see at the moment we're really working on, for example, the Convention on the Rights of People with Disabilities that looks at supported decision making rather than our act, which is substituted decision making. And we see that because that convention has been ratified by New Zealand, that we have to work on that and look at that. And so I guess what we're saying is, and I often raise this when I'm talking with people, is what difference would it make if we had been able to get through that the convention that I know many groups of older people advocacy groups have been fighting for some years and do it every year. And I leave you with that question. Thank you.
Thank you very much, Hanny, for bringing, sharing your work and of age concern in New Zealand. And, I'm finding that we have many similarities between our different countries, which we talked about here. And I'm glad that a lot of viewpoints have been shared in terms of what is existing in the countries, what more needs to be done, what are the challenges. And in a way, there is kind of consensus that just looking at it from a legal angle is not the right solution. We need to have many community development programs and look at it from a very social, economic, and psychological concern, and also as a medical concern, health concern. And we need to look at it in many ways. Please look at the chat if there are any comments on your presentation or on Dan's presentation. And Noriko looked at it, she responded, and then she had to leave. She had another meeting. I was also going through the chat. I don't see much except, yes, appreciation and agreement that, yes, what we are discussing is the right way and it needs more attention. But I would still open the floor in case anybody wants to make a brief comment. Please raise your hand, then Catherine will unmute you. But I want very, very brief comment or a suggestion which can be taken forward. You can put it in chat, but if anybody wants to make an urgent comment, please feel free. Just raise your hand in the go to reactions. Raise your hand, and Catherine will allow you to speak for a few seconds, maximum 1 minute, because we need to then conclude and close also. But I think it has been a very enriching session. Thank you to the speakers. Yes, anybody?
Did you see the one about the caste system? The comment about the caste system, Amala?
Yeah, I'll just have a look. What does it say, if you can read out?
Okay, hang on. It says, till this time, the caste system is practiced in India. Do you think elderly people from the lower caste would be treated in a better way?
Yeah. You see, that is the issue, like I had discussed in my presentation, that it should reach to all cross sections of the society. Any measure which is adopted at the country level should be able to include and be effective for all kinds of people from socio-economic groups. And the legislation is going to work in many ways. It is taking interest of lower sections because it is the family with which they are dealing. You see, it's not the dealing one caste versus the other caste. So it's within their group. You are dealing with abuse by the family members who belong to the same caste system. So, the caste doesn't really play along this. And, we have various village panchayats. We have in some of the areas, the tribunals have been set up where the legislation is being put in place. But yes, what is becoming an issue is that we still need data to identify among which groups elder abuse is happening more and why. At present, we find commonalities cutting across socioeconomic groups. And basically, some of the fundamental things is illiteracy. Fundamental thing is not access to legal system, awareness of what exists and what they can use for their own benefit. And more than that, it is awareness of aging issues, the complexities of the needs of older persons, which needs to be identified. And we also need to look at the care aspects in a very holistic aspect. Self-care has to be promoted, dependency has to be reduced, and ageism needs to be stopped. So there are various, I think, social responses which are very necessary. Any other comment, please? Please, all of you, I've also put my email. Catherine has also put, Noriko has also put her email. I think Henny and Tang, you are free to send us and clarify or share your research, your thoughts. And like Catherine said, we can do a section in the newsletter on, comments related to this. We will be writing a report. So please go ahead. Anybody
Dr.
else who
Mala?
would like?
Dr. Mala,
Yeah.
can I say something?
Yes,
Yes,
very briefly.
Ashima, go
Yes.
ahead.
Yes,
First
Ashima,
of all, yes, first of all, like to congratulate the whole team and especially you for taking it up. It was a fantastic experience to have heard all the speakers. I have two things on my mind. One is I want to
Yes.
know if there is any research that has been done to identify which society or which culture there is more abuse and which culture has less abuse. This is one. And secondly, I would like to know that as we are aware that many of the young or maybe the middle age, they start to plan for their future, which means that they kind of start to invest for people, for themselves to be, a part of some facility where they would like to be after they retire or after they grow old, so that there is less burden on their own caregivers. They start to, invest in it. Which culture it is happening more, and is it happening around in Southeast Asia as well?
Yeah, thank you for your comments. Actually, it is very difficult to say in which country abuses more, because we don't have the same kind of research protocol and guidelines to capture the reporting, to capture the cases of abuse, forms of abuse. But all over, in general, it is seen that family members are abusing. And we are seeing, especially in many of the European and Western countries, institutional abuse is becoming very high. Financial abuse in today's globalization era, digital means of doing various activities is increasing. So a lot more research needs to be done to identify exactly what is the root cause of elder abuse, how many cases are under different forms of abuse, to talk about reporting, to talk about many governments still don't have mandatory reporting mechanisms in place. So there are various issues, and we who are working on this concern are step by step trying to deal with many, and that is why this meeting was also identified. Yes, if you make the senior citizens live on their own and have nothing to do with children, they have provisions in senior citizens complexes and all. But this is happening. But we are now looking at research in some of these places. We are also looking at how the community is responding to elder abuse cases. How do friends, neighbors, are they the perpetrators too? And especially in terms of financial abuse, it is coming that very often a very trusted member of the older person is the one who is abusing the older person financially. And, so these are various concerns, and a lot more research needs to be done to capture the scenario from a scientific, evidence-based thing, and also governments to look at what is the implementation flaws. Where is the government, if which has things in place, going wrong? Does it reach? So here, awareness about issues which concern older people is low in most countries. And there is some good research coming out by WHO, by various national surveys. We have our own study in India, the LASI, the longitudinal study on aging, bringing up some findings on this, and various reports by various NGOs. Certain books are capturing, so a lot more needs to be done, lot is happening, and we hope the seminar will take us forward in terms of thinking whether what is the most appropriate, rightful approach to address and protect, safeguard older people. Are community-based resources the answer? Is legislation, legal mechanisms the answer? Do we need more of public health facilities and approach which emphasizes on care, which talks of protective services? And main thing is that every country should give priority to this issue in dealing with it, in terms of generating more research, in terms of coming out with evidence-based approaches. What works? We still don't have enough research to know what works to reduce elder abuse. But bring in voices of older persons also to understand what exactly they need and what exactly are they going through. So we need many more caregiver interventions. We need programs to understand why exploitation is taking place, what kind of protective and security measures a country should adopt. And, we find that many countries in the world have adopted legislations. They have enacted laws to address elder abuse, neglect, exploitation. These are countries all over, mainly in Europe, America, but we have many now Asian countries also looking at it because of initiatives of WHO, which has a big program as part of Decade of Healthy Aging to look at elder abuse concerns. And they are having various meetings which are looking at various interventions and responses. And also many countries are looking at it. I mean, a lot of my work involves a review of these approaches, and some people from various countries are repeatedly contributing chapters to my books, which are being upgraded to talk of this. And so I think it is also the pandemic, the COVID-19 pandemic, which brought in many new aspects of elder abuse. And it has brought again attention in a very serious way. So I think we need to really look at it, whether criminalizing and legalizing family care is a solution, or we need some more service-oriented responses, community responses. And I hope this session would make you think, and please feel free to send your comments to Catherine. We can make, like I said, debatable kind of issue in terms of our newsletter of ACAP. And you can interact with all of us who are working on this to take this forward. And I think now I will just go to Catherine to, sort of give her comments. And thank you all for your
Mala.
participation. Yeah, and your chat comments have been very encouraging, and we hope on my behalf that we continue our dialogue. Catherine, over to you. Thank you so much, everyone.
Thank you so much. Yes. Well, this has just been fascinating, and I think we could talk for hours about this topic because it's complex. There's a lot that's not known there, and one size is not going to fit all, clearly. But I'm going to stop the recording now, and so thank you all. Stop.